At the ripe old age of 5 years old, I knew what I was going to be when I grew up. When I grew up, I was going to be a superhero and I was going to have X-ray vision. So I started thinking about it a little, and I definitely knew 100% I wanted it because I wanted to know what was inside of my birthday presents. As time went on, I realized who else might need X-ray vision and why would they need it? Maybe someone like a neurosurgeon could use it. Minimally invasive surgeries are becoming more and more prevalent in hospitals. This means that surgeons will opt to use a smaller incision rather than a large one to carry out the surgery that they normally would. Now, why would they do that? Well, we maintain a standard of care which actually improves patient outcomes, things like a lower infection rate, lesser dosage of medication, and a faster recovery time. Patients can go back to their families and back to their daily lives sooner than ever. That's fantastic and that's amazing. But there is a big drawback, and that is that they add time to surgery. We're talking about going from a 4-hour surgery to something like 6 hours, and it costs $147 per minute to run an operating room. Every single minute matters. So why do they take so long anyway? Well, it's because surgeons simply can't see the landmarks that they're used to seeing. They can't see this crease in the skull or this pointy part of a spine that helps them navigate through the human body. It helps them orient themselves and continue the surgery. It's almost like you would think they need X-ray vision to see something along those lines. They would need to see all these landmarks to help them out. This is where my research comes in. What if we had a way where we can just throw on a pair of glasses and see everything we need to see in a snap? Well, I've designed this pipeline where we take a CT scan, which is a series of cross-sectional X-rays, and if we sandwich them together, we can get a 3D model. This 3D model can have a skull, and it can have the tumor inside that we're interested in seeing. With the use of augmented reality, we can see the skull floating in real space, kind of like Pokemon Go, where except instead of a Pokemon, you have a skull with a bright red tumor inside. Imagine if we take this virtual model and align it with the patient's head in real life now. Well, we can see the tumor, and we can see everything else we need to see in order to carry out the surgery without making a single cut. Well, it's been 20 years since I was 5. Am I an adult yet? Definitely not. Like, what are taxes anyway? Am I a superhero? You definitely know I am. The next step is to make surgeons superheroes too. Thank you.